When did we sever the head? You might be picturing the guillotine of the French Revolution, but I'm speaking more metaphorically here. What I mean to ask is, when did modern Western medicine decide that mental health was something altogether different than health pertaining to anywhere else in the body? And what does this mean for mental health policy? Today, the Mental Health Parity Act and the Mental Health Paradox. I'm Elizabeth Hopkins, and this is ERISA Watch. According to the U.S. Department of Health and Human Services, 1 in 5 adults have experienced a mental health issue. 1 in 10 young people have experienced a bout of major depression, and 1 in 25 Americans lives with a serious mental health disorder such as schizophrenia, bipolar disorder, or major depression. The numbers with respect to addiction and other substance use disorders are perhaps even more alarming, and drug overdoses now cause more deaths per year than car accidents and guns. So mental illness is extremely prevalent in our society, but it's often associated with stigma and blame, issues I want to explore more in future episodes. What I want to talk about today is how our ways of thinking about mental illnesses have led to mental health treatments and even mental health policy being systematically cut off from the rest of healthcare. And as is usually the case, separate is not equal. It struck me as interesting that one area of medicine, neurology, more or less reattaches the mind to the body, which is where it belonged all along. Here to talk with me about this is Dr. Joshua Warach, the head of neurology at the VA Medical Center in Brooklyn, New York, an esteemed neurologist who just happens to also be my cousin. Hi, Joshua. Thank you so much for joining me today.
Well, it's my pleasure.
So, from your perspective, working as a neurologist for the VA, how do you see these two fields fitting together? And, what does the overall picture look like from your perspective?
So first, it's a pleasure talking to you. And of course, my views are not the VA official views. They're my own. So the issue is, how does neurology relate to psychiatry, or a broader issue, mental health? And I think they're very closely related and integral, in fact. So for me as a physician over many years, to really understand a patient and his neurologic problems, I have to understand where that patient comes from, what his emotional background is, what his social background is, what his mental health background is. They really tie into each other fundamentally in the symptom presentation, often and very much, importantly.
Well, that really makes sense that, you're treating the whole person. You don't just treat some aspect of them in some sense, even though obviously
Right.
You're a specialist and our, medical system is set up to be, to some extent, a system of specialists. But so how do you feel? Like what happens at the VA? Do you think it's well integrated, psychiatry along with other aspects of medicine? What's your experience been?
Sure. So let's take some examples. So I'm a neurologist. I work as chief of neurology in the Brooklyn VA Veterans Administration Hospital, which I'm very proud of. Their model is really integrated, as it is at every VA. So the colleagues next to me are the psychologists and the psychiatrists. So let's take a patient with headache, right? So when did the headache begin? What are the factors? But let me address some of the psychosocial factors. So many of our patients have PTSD, depression. They've really been through some heavy trauma. I mean, you can only imagine combat veterans and so forth. And those experiences and emotions really play a factor in how they experience headaches, the onset of headaches. If they've had head trauma, and something like 80% of the combat veterans have traumatic brain injury, TBIs, it's really important. So if we don't address those other things, we're really not going to be able to cure the problem. There's a whole area of psychoneurology now, in fact. I'm sure there are many researchers who are studying the biology of psychology, psychiatry, and neurology even something as commonplace as for headaches or back pain or musculoskeletal pain. This is really fundamental. And because I really take a whole person view, a holistic view of the patient, this is really important. And often, when you're open to that as a provider, as a physician, people talk to you, and that sometimes helps too, even if I'm not a psychiatrist.
Yeah, that is really interesting. And I do think though that the VA model, which seems to me to be a pretty good model that works really well for a lot of people, it seems like it's unusual in our system.
Yeah.
Do you think?
Yeah. So let me just jump in there. So I'm really actually very, very, very proud of the Veterans Administration and how they approach it. They take a fully integrated whole human, whole patient view of all of our patients, all of our veterans. I kind of wish that was a universal principle. It is in many other health systems, but particularly so in the VA. So we work in collaboration with all our providers, mental health providers, psychiatrists, psychologists, the neurologists, the medical team. Let's say we see a patient who's having a mental health issue. We can immediately access psychiatry and psychology. I mean, we can even take a patient by the hand and walk them right down. Pre-COVID, now it's more online and so forth, but right to mental health. Even something as simple as the medical record system. The VA has one of the best electronic medical record systems in the world. So someone can check into Honolulu, Hawaii VA. I'll have that report the same day or the next day. So they're all there in one place. The psychology, the medical records, which is really important, isn't it, when you think about it? Because so much of medical care is fragmented, especially in the civilian world. Someone sees one specialist, they might not get a report at the other doctor's office. You can only imagine, et cetera, et cetera. In the veterans model, it's all there in one place. And I really think that's important, not just with mental health and neurology care, but just general medical care. You would want your doctors to have access to your records immediately and broadly.
Yeah, I mean, that really does seem like something that's fundamental. That's, again, I think starting to become part of all of medicine, hopefully in the United States, but we're certainly not there yet. And I think, the fragmented nature, like you say, of medicine has been a real problem for anybody struggling with medical issues, and I think particularly for people struggling with mental health issues. And it really, I think the VA shows us, it doesn't have to be that way.
Right, right. So let me add something else. Let me take, for example, homelessness. This is a problem not just in New York City, it's across the country, but especially in the veterans population. We have a number of veterans at all times who are homeless. The VA actually has a homeless outreach program. It tries to arrange for homes, places to stay for the veterans. It has a kind of an integrated work program where veterans can get back into the workforce. It's just wonderful. So it not only provides medical care, but it understands that if we don't take care of the physical and social needs of our patient population, we're not going to be successful in the long run, because it's kind of the whole person approach, emotional, social, physical. And as a neurologist, I see many of those patients, and I always try to go beyond just my own specialty, my own niche. I try to reach out to the other providers. If they need mental health, I'll try to expedite that. And I think most of the providers I work with they know the system is there and it provides for the veterans. So why not avail themselves? These guys and gals have certainly earned every bit of our respect and our care. And I think it's kind of like a new VA. It's not the way it was 30 years ago when I was a resident, and many veterans avoided the VA. Now, I think it's a home for many, and the more they integrate with or interact with the system, hopefully they'll have good experiences and positive medical outcomes.
It just occurred to me to ask you about the question of stigma among veterans dealing with medical issues in general. I think because, veterans tend to be people who are very self-sufficient and tough, but especially with mental health issues, which again, I know you're a neurologist and not a psychiatrist, but do you think that this system helps sort of overcome some of the problems of stigma to some extent as well?
That's really, Elizabeth, a great question. In the first place, I think years ago, even if you were a veteran, you carried a stigma. I mean, the guys who came back from Vietnam lived through that nightmare. Now, the first thing is, as a society, we really respect and honor and cherish our veterans. So that's the first thing. And society has come a very long way. Now, when it comes to mental illness, I think the VA has gone out of its way in encouraging veterans, if they have mental problems, it is not a stigma. It has to be brought to our attention. I'm sure there are many veterans who don't, maybe especially the older veterans, but who don't bring that up. But we really encourage it. There's screening at almost every visit. We've been encouraged you ask the veterans about their mental health, their suicidality, and so forth. I mean, we really have to go out of our way. And I think we have to be vigilant at all times. And there are support groups. So a lot of the guys and gals who come back from the service, they're with other veterans in support groups, and they've been through the same experiences and understand it is not a stigma. I'm sure there is that burden. I'm sure it continues, but I know the VA is doing everything it can to destigmatize, because we have to get the help to where it's needed and prevent suicide. There's still a lot of suicide every day amongst our veteran population. So anything we can do, but it's ongoing, Elizabeth. It really is. And your point is so important, that we work and encourage people to destigmatize mental health needs.
Yeah. And of course, the VA can't overcome all of societal stigma, but at least they're working hard not to set up additional stigmatization of people and additional obstacles. And that's super important, I think, from a healthcare system.
I think so. And also, my understanding is that the Department of Defense, the military, is also working within its ranks to destigmatize mental health issues. And as that comes to fruition, hopefully, as they leave and are separated, discharged from the service, they'll be more willing to seek out the care that's there, in which I tell all my veteran patients who I dearly care for and love, you earn this. Let us help take care of you,
Well, I really this is a fascinating discussion, and I really see a couple of the VA and maybe to some extent Indian Health Services, these public health models as truly models of what should be happening across the board in healthcare. And I think honestly, I think the COVID times have sort of pointed that out. I think the VA and other like Indian Health Services have done a really excellent job of treating COVID patients and also of getting people immunized really quickly. You have my complete admiration, Joshua, for working, during these times. I know it must have been really difficult, but I think, the VA hospitals have done an amazing, amazing job.
Yeah. Well, I'll tell you, just from the COVID vaccination point of view, every veteran I talk to is, and me too, I'm kind of amazed at how good and well the VA rolled out its vaccinations. So now veterans can get their COVID vaccinations. I know there's still some vaccine hesitancy. I tell my veterans, for sure, we know COVID can kill you. So this vaccine is our hope. Please avail yourselves. And I think just in general, I know it's a big bureaucracy. There are always problems, but the VA actually does what it can to correct things. It's kind of a dynamic. And I don't see that, in any other way in other places as robustly, that they really try to make things better and continuously improve our veteran experience from mental health, from all the medical specialties. But we work together and collectively. So That's a good thing.
That's great to hear because, the head is part of the body. Everything that we're experiencing is part of ourselves, and we really do have to learn to take a less myopic, I think, view of the treatment of people of all their medical needs. Well, it's been great talking to you, Joshua. Thank you so much. I really can't thank you enough for taking time from your day to do this. And also thank you for, being on the front lines of COVID, as they say. You're a warrior yourself.
Well, thank you very much. It's certainly been a long and rough year. So better times ahead, and we'll keep working at it, all of us. Thank you.
So now on to the law and policy with respect to mental health treatment. It's been the case for a long time in this country that insurance companies and ERISA plans have treated mental illnesses much less favorably than other kinds of illnesses. Sometimes they've excluded coverage for mental health treatment altogether, and in other cases placed more restrictive limits on the number of days of treatment, imposed higher cost-sharing requirements, or put more onerous pre-authorization requirements on patients seeking mental health treatment. In an attempt to address this unequal treatment, Congress responded first in 1996 and then again in 2008 by passing the Mental Health Parity and Addiction Equity Act. Among other things, this law prohibits plans and insurance companies from imposing different treatment limitations and higher cost-sharing obligations, but only if the insurance policy or plan covers mental health conditions in the first place. It wasn't until the Affordable Care Act, or Obamacare, came along in 2010 that health plans were first required to provide mental health coverage as part of essential health services. So here we are more than a decade after these laws were passed, and it's fair to ask, how is this working? Has the gap been addressed? Here to discuss this with me is Lisa Kantor, one of the founding partners of my firm, Kantor Kantor, and a leading expert on mental health parity laws, as well as a leading advocate and attorney on behalf of those suffering from mental illnesses. Thank you for being here with me to discuss this important topic.
My pleasure.
So this is going to maybe be a question that'll make you laugh, but I've got to ask it. Has parity been achieved, and are mental health and addiction disorders now being treated the same as other medical conditions?
Well, as you probably expected, the answer is no. It's good news that we have mental health parity laws, but we have a long way to go before mental illnesses are treated in parity with physical illnesses. In California, we are doing a little better because we have a slightly stronger parity law that requires, up until January 1, 2021, required all medically necessary treatment for 9 severe mental illnesses, and now has been broadened to include all mental illnesses, which is fabulous. On the federal side, which governs most people in this country, it's a balancing act. It's a balancing test. So if you're treating physical things a certain way, you have to treat mental things a certain way. But the problem is, as we all know, mental health is treated differently. I mean, we have different modalities. We have different ways we treat. And, calling it equal or arguing for parity is nice, but it's not the same as saying you really should get whatever treatment you need to help you get better.
And is that more what the new provisions in the California law aim to do? And do you have hope that that the prospects are better for really achieving greater parity, if not complete parity, at least in California, under this new California law?
Yeah, I do have some hope we're going to do better in California. I think it's fantastic to hear that every diagnosis, every mental health diagnosis has to be treated with parity. In other words, has to be offered the right kind of treatment. I think that's going to go a long way. But, our fundamental problem is stigma. If people still view mental illnesses as not real, as not being the same as a physical illness. It's very difficult to get the same intensity of treatment, attention to treatment, research about treatment, and sort of dedication to helping people with mental illnesses.
I totally agree. And I think that the insurance companies and the healthcare plans are sort of stepping into the gap that's left by that stigma and taking advantage of it to some extent to deny treatments. But I think I do agree that I think, the fundamental problems probably lie in society at large, in medicine at large, which, tends to treat mental health disorders differently and conceptualize them differently than other physical disorders. Although, I hope that in the future that that will be less so. What do you think about that? Are those do you see those gaps as narrowing and the treatment coming together a little bit more?
Again, I think we're getting closer, but you are right. Insurance companies, if they see a little bit of a sliver of ability to deny, they drive a truck through it. And there's only so much legislation can do because you can't think of every way in which an insurance company can figure out how to get around it. And insurance companies, frankly, can only do that because we tolerate it in our society, because we don't believe that people with mental illness are as worthy of attention and treatment. And that's going to take a long time to change. We see this so often, so glaringly with eating disorder patients, because a lot of these patients are young. They haven't really started they're either in college or high school. They haven't really gone out there and gotten jobs. And when they get good treatment, they turn out to be flourishing, contributing members of society who, have families and children and good jobs and contribute. But when they don't, they end up in a revolving door of treatment. And, it's not good for any of us, for our society, for their family, for them. Nobody would want to see that happen.
Well, I just have to say thank you to you and other people who are, working with patients who are suffering from mental health disorders and addiction and substance use disorders, and trying to address these issues through the law and more broadly in speaking out about this as an advocate. I think it's really important. And, I hope the future is a little bit different than the past with respect to these mental health parity issues. Thank you, Lisa, for joining me. You're the busiest person I know, so I really appreciate you taking the time out of your busy day, and talk to you soon.
All right, thanks. And thanks for bringing this to your listeners. I appreciate it.
Access to coverage very much depends on what insurance companies think they can get away with. Because we have split off these illnesses from other types of illness, like dementia, epilepsy, or the like, and society has stigmatized people who suffer from mental illness and substance use disorders, insurance companies can more easily deny coverage without people, like judges, becoming outraged. Hopefully, new and improved public health policies can help to address some of this inequity. But I think we also need to try to change our own thinking about these issues and stop splitting off our minds from our bodies. Today's episode was brought to you by Kantor Kantor. Our producer is Emily Hopkins. Our composer and engineer is Andrew Payson. Special thanks to Dr. Joshua Warach and to Lisa Kantor. New episodes of ERISA Watch will be available the first Friday of every month. I'm Elizabeth Hopkins. See you next time.